Well, what are injectables? And we're really talking about two different subjects tonight, both related to the face.
Right. And injectables are really divided into two types of treatments. One is a muscle blocker, blocks nerve endings. One is a filler to fill defects.
Okay. What are the differences between fillers, such as, well, talk to me about the different kinds of fillers there are and different types of muscle blockers and how they work.
Sure. Muscle blockers actually block the junction of the nerve ending with the muscle, so that the nerve is sending an impulse, but the muscle's not getting it. It does that by competitively binding to that nerve ending.
Brain's saying do something.
Exactly, but the muscle's not getting the message. Whereas fillers, we're using those to fill in defects that are already there. So we're trying to plump up tissue where we've lost fat, where things have fallen and created creases that aren't natural.
Now, there are two kinds of wrinkles. I don't like any of them, but there are two different kinds, dynamic and static wrinkles.
Right.
What are the differences?
Dynamic wrinkles are caused when your muscles fire, and when they fold, they create folds in the tissue. So that's an active thing. When you're frowning, that's an active dynamic wrinkle. At rest, when you're not moving your muscles, the creases and wrinkles that are there, those are static wrinkles.
Okay, so typically on a face, feel free to use your hands,
Sure.
Where would we see dynamic wrinkles? And
dynamic wrinkles are the furrows in here, in between your brow. When you smile, the crow's feet area, those are dynamic wrinkles. Now, at rest, I also, when I raise my forehead muscle here, I create these, but at rest, unfortunately, I've still got them here. So those are static that have been created from dynamic movement.
Okay. Are these inpatient or outpatient procedures that we're talking about tonight? And that is the correct term, procedures.
Sure.
These are not a surgery. We want to make sure people know.
Right.
How long do they take, meaning the procedures, and how long do they last?
The procedures are an office procedure. So you come in, you can get this done.
Your office, not mine, by the way.
Exactly,
Right, okay.
exactly. On a break, you can get it done at lunchtime. They take less than 10 minutes. The results are seen typically within a few days up to a week. Now, again, we're talking about muscle blockers. They last 4 to 5 months in my hands. Cost-wise, it ranges anywhere from $300 to $500 per area, and depends on the area of the country, those types of things. Much more expensive, say, in the Northeast than they are down here.
Okay. Do you recommend the same treatment for all of your patients? Now we're talking about muscle blockers.
Sure. Everyone is different. The same substance or product can be used in everyone, but the areas that you're treating vary from individual to individual. Some people will have the dynamic 11, and you'll see here on the left of your screen a person frowning on there.
Right above the eyes, in between the eyes.
Exactly, exactly. When you're angry with someone, that is so-called 11 that you see there. That's a pretty common area that we use it. We also use it in the forehead for those kinds of wrinkles. Also in crow's feet region, when you smile, those muscles fold, or the muscles cause the skin to fold, and that stops those.
Well, most of us have heard about fillers and muscle blockers, and not all of what we have heard is positive.
Right.
What are the myths and what are the facts as they relate to injectable fillers?
There's a bunch of myths that have been perpetuated. First and foremost, I guess, would be thinking that the fillers and the muscle blockers are the same thing. They're not. One, again, blocks the muscle function. One fills a defect in an area. Another one would be that the Botox or Dysport, which is a botulinum toxin A, is a poison. Yes and no. It is a poison, but it's a highly purified poison that is produced in medical labs, highly purified, FDA regulated, and it is in small amounts that we use this. So these things are used medically and have been for many years for medical types of problems, not just cosmetic. Another one is that, again, Botox is a filler. It's not. I have patients come in and say, what about the Restylane? Well, can you use the Botox instead? Well, it's used for an entirely different kind of thing. Some people say, well, what about the creams that are used? Can I do that instead of doing this Dysport or Botox? The creams are only for the skin. Your skin is an organ and it blocks absorption. It's not going to get down to the muscle. It's not going to get down to the dermal layer to fill these things in. It's not going to block those muscles. So no, it can't be used like that. Another myth would be that Botox or Dysport will leave you with a frozen face. It can in the wrong hands. You have to have a person who is trained in using these types of things, know where to use it, know how to use it, know how much, where to place it precisely. It's very important. So yes, you can have a frozen face. That people think about the Hollywood people and all that. You can have too much. So you need to use it within reason in the areas that I described.
What about Botox, the building up of Botox?
It does not build up over time. It is degraded by your body, and that obviously is why it only lasts 4 to 5 months at a time. It doesn't build up anywhere. Studies have shown that.
Okay, and that it can give you a startled look. This is something else we've heard.
Right. Again, if it's used in the wrong place, it can. Your brows can come way up, and you can't move them in a proper fashion. It can do that, again, if used improperly.
Okay. You talked about being in the right hands, so this is just as good a time as any to ask you this question. I'm told that dentists are now performing some of these procedures, and that ophthalmologists are now performing some of these procedures. I guess the idea is while I've got you here and I'm working on your smile, you've got some wrinkles in this area,
right.
Or while you mentioned the eyes is the first place people look. While I've got you in the chair and we're working on your eyes, why not do this? First of all, what do you think about that idea of ophthalmologists and dentists? And my understanding is you don't even have to be one of those to be handling some of these procedures.
Right.
What sort of questions should patients be asking for those people offering these services?
Right. Well, the ophthalmologists typically are trained in these types of things. Dentists, not typically in your normal training. Now, obviously, when I was trained, this wasn't around, so I had to take some extra course and that sort of thing, extra training in this to be proficient at it. And yes, you need to do that, and yes, it's offered through the company, and you are certified with this. The people that really worry me the most are people that are quasi-medical type people. People that are running aesthetic shops that aren't accredited out of their garage, their house, that type of thing.
Maybe even some other countries. You've talked
Absolutely.
about people going to South America.
Yes, for instance, I had 2 patients that left to go to South America for cost reasons. One of them did well with theirs. One of them got a very bad infection that required multiple surgeries to excise this infected tissue out, and so again left with some scars there as well.
What sorts of questions should patients be asking? Perhaps the number of times someone has done this procedure?
Exactly. I would ask, how often do you do this as a physician? Are you comfortable with this? Are you trained with this? Pictures of patients, like you had mentioned, previous patients that you have. Those are things that you really should ask. Other patients, maybe there's patients that are willing to talk to you. What was it like? Word of mouth is really an important aspect on this, and don't go just for the cheapest price. You really, again, get what you pay for.
You started talking about muscle blockers, so let's wrap up there.
Sure.
Are the results immediate, and how long do they last? Again, we're talking about muscle blockers.
Exactly. Some patients I've had rarely have an effect within a few hours. Usually it's 3 to 7 days for your maximum effect on the muscle blockers. And that lasts, as far as how long they last in these areas, would be typically 4 to 5 months in my hands.
Okay. You brought along some pictures here that we can take a look at.
Yeah, and you can see on the left of your screen here, these are patients who are frowning, like you're angry. You can see the dynamic folds that are created in there, and then on the right, after injection with the botulinum toxin A, these are patients that have had a full effect. Now they're trying to frown again, but it's not moving there.
And then one more picture, and actually this is broken up into 4 pictures.
Right. This is actually one of my patients that, and we'll see a video later, this young lady had some furrowing in the central aspect of her brow, and we injected that. You can see the top 2 photos, left being pre and right being post. Then on the crow's feet lines, the smile lines, here she is smiling after injection on the right. You can see they're markedly diminished there.
Well, we've covered muscle blockers. Now let's move into more detail in the area of fillers. Do all fillers work the same, and what are the different types of fillers that are used?
All the fillers are used to fill defects or fill creases or fill these depressions. Different levels of filler in terms of where you place them make the difference in there. There are different types of products that are made to use in these areas. The main ones are the hyaluronic acids, and those are the Restylane and the Perlane, the main ones that I use, also Juvederm. Another one is the calcihydroxyapatite. It is something that is used for deeper kind of filling. It's been around for a long time, used in urological procedures, used in vocal cord procedures, used in TMJ type procedures. So these are the things that have been around a while. It's a little bit different material in that it's a much finer grade now that we use for fillers here.
What about collagen?
Collagen also, when I first started, that was what we had, was collagen, and it was bovine derived from cows. You had to be skin tested. You had to wait several weeks before you came in, and I found, at least in my hands, it just didn't last very long at all, maybe a month. To me, I really quit doing injectables at that point because it wasn't worth it. They just wasn't lasting. Along comes the hydroxyapatites, and those are the ones that really set the bar from there, because they last a long time. They naturally occur in your skin, so people like that about these, and they're easy to do. No downtime, no skin testing. Those are things that are positives there.
Skin testing for allergies.
Correct. Exactly.
What are some of the things a patient and their doctor should discuss before moving forward with fillers?
Well, first of all, is this the right thing for you? Some patients
This is the counselor part, right?
This is the counselor part. When patients come in, some patients don't need anything. So I'm looking maybe a little deeper into what are the other issues? What are you seeing that I'm not seeing? And so we go from there.
You'll actually give them a mirror, right, and ask them to show you?
They hold the mirror up, and I say, what's troubling you, what's bothering you about your face, and we'll go over things like that. A lot of people look great, and I tell them, you don't need anything here. You're beautiful. You look fine the way you are, and then we'll discuss other issues. Some people come in for fillers or Botox when they're past that time. Frankly, they are beyond the time where it would be cost effective for them to use a large amount of filler to do what they need to do, and they may need brow lift or facelift or blepharoplasty, things like that.
Which are surgeries.
Which are surgeries, right? Downtimes, those things, but they're a bigger, more lasting kind of thing. Right.